Center Test Prep Exam Book PDF. Question 1. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. Synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. Transcutaneous pacing. The correct answer is option C. Immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 2. A patient with a suspected spinal cord injury develops hypertension and bradycardia. The nurse suspects. Option A. Hemorrhagic shock. Option B. Neurogenic shock. Option C. Cardiogenic shock. Option D. Anaphylactic shock. The correct answer is option B. Neurogenic shock. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic activity causing vasodilation, hypotension, and bradycardia. Question 3. The best method to remove a prosthetic eye in an emergency is: Option A. Using forceps to grasp the prosthetic. Option B. Applying suction with a bulb syringe. Option C. Using a suction cup designed for prosthesis removal. Option D. Sweeping a finger around the edge to break the suction. The correct answer is option C. Using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 4. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F. Hyperkalemia. Option B. Hypercalcemia. Option C. Hypercalcemia. Option D. Hypermagnesemia. The correct answer is option C. Hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias. Question 5. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. Constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 6. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive for fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all for fluids. The correct answer is option B. Keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 7. The golden hour for acute ischemic stroke refers to the window for: Option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. The golden hour in stroke care refers to the critical importance of rapid assessment and treatment. For TPA is generally indicated within 3-4.5 hours of symptom onset in eligible patients. Question 8. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 9. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypertension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Epinephrine is the first-line and most critical treatment for anaphylaxis. It provides both alpha, vasoconstriction, and beta, bronchodilation, effects. Administration into the anterolateral thigh is the preferred route. Question 10. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 11. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 12. A patient with an acute myocardial infarction develops a new hollow systolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture, a mechanical complication of ME. A VSD murmur is typically heard best at the left sternal border. Question 13. Meningitis is an inflammation of the. Option A, brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and the cerebrospinal fluid within the subarachnoid space. Encephalitis involves the brain parenchyma. Question 14. The most effective method to control severe bleeding from an extremity wound is. Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 15. The priority patient for a trauma team activation based on mechanism of injury is. Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 16. The antidote for acetaminophen overdoses. Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenil. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion. Question 17. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is Option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 18. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is Option B. Hypoperfusion and anaerobic metabolism. An elevated serum lactate, 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism, which is a key indicator of severe sepsis and septic shock. Question 19. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. Damage above the midbrain. Option B. Damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is Option B. Damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 20. Priapism is a urological emergency characterized by Option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. Scrotal edema. The correct answer is Option A. Painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 21. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate Option A. No tetanus prophylaxis needed. Option B. Tetanus immunoglobulin only. Option C. TDAP or TD booster. Option D. Tetanus toxoid and tetanus immunoglobulin. The correct answer is Option C. TDAP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a TDAP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 22. The safe harbor provision for nurses typically refers to Option A. A law that provides legal immunity in all circumstances. Option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is Option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 23. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is Option A. Absent breath sounds. Option B. Dullness to percussion on the affected side. Option C. Trickle deviation. Option D. Subcutaneous emphysema. The correct answer is Option B. Dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 24. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 25. The most common cause of airway obstruction in an unconscious patient is: Option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention.